Lele Pons DWTS 32 performances, Dancing with the Stars. The fluorescent lights in my private practice hum their familiar drone as I scroll through another patient file riddled with questions about vacuna contra el dengue. My coffee's gone cold, again. It's been that kind of week. 3 different clients have come in convinced they need this vaccine, armed with internet research and genuine fear about dengue fever spreading through their travel plans. Here's the thing though, nobody's asking the right questions first. In functional medicine, we say the body doesn't operate in isolation, and frankly, nobody's bothering to check if this intervention even makes sense for these specific bodies walking through my door. Let me tell you what I've learned digging into this topic, the real conversation nobody seems willing to have. Let me break down what vacuna contra el dengue represents in the current health landscape, because I think there's massive confusion happening here. This isn't some mysterious new intervention. It's a vaccine specifically designed to protect against dengue virus, which, if you're not aware, is transmitted by mosquitoes and can cause severe flu-like symptoms, and in some cases, hemorrhagic fever. The World Health Organization has been tracking dengue spread for years, and the numbers are genuinely concerning. We're seeing expansion of endemic areas, which means more people are at risk. Now, here's where my functional medicine brain kicks in. The conversation around vacuna contra el dengue tends to go one of 2 ways. Either people have zero idea it exists, or they've heard fragments and don't understand the nuances. The vaccine in question, let's be specific, targets 4 different dengue serotypes. That's important because getting infected by one serotype doesn't grant immunity to the others, and there's this weird phenomenon called antibody-dependent enhancement, where subsequent infections can actually be worse. The vaccine tries to address this complexity, but here's my concern. We're talking about a medical intervention that changes immune response, and nobody's asking what else is happening in that person's system. I've had clients come in wanting the vacuna contra el dengue because they're planning trips to Southeast Asia or South America. They see it as a simple solution, a shot, protection, done. But I'm looking at their gut health reports, their inflammatory markers, their vaccination history, and I'm thinking about how their immune system will actually respond. It's not just about whether the vaccine works, it's about whether it works for this person with their specific health picture. That nuance gets completely lost in the mainstream conversation. I spent 3 weeks going through published data on vacuna contra el dengue, not the marketing material, not the travel clinic brochures, but the actual clinical trial data and post-marketing surveillance reports. Here's where I found that's worth sharing. The vaccine uses a live attenuated approach, meaning weakened versions of the dengue virus strains. The theory is your immune system mounts a response without causing actual disease. My background as a former conventional nurse gives me enough foundation to read this data critically, and honestly, there's some impressive science here. The phase 3 trials showed efficacy rates that varied significantly depending on serotype and prior exposure status. For people with previous dengue infection, the vaccine provided meaningful protection. For those who'd never been exposed, here's where it gets complicated, the results were less clear, and there was actually a signal of increased risk for certain age groups. This is exactly what bothers me about the vacuna contra el dengue discussion. The effectiveness isn't uniform. It's not like the measles vaccine where you get it and you're protected. This is context-dependent in ways that matter enormously. A 25-year-old with no prior dengue exposure has a different risk-benefit profile than someone who's already had dengue twice.